Good Monday morning to everyone. It is our morning media update. It is June 29th. So glad you're joining us. Hope everyone had a great weekend. I'm Jessica Lovell, in for Dr. Steve Stites today and actually the rest of this week. So thanks, guys, for being here with me. We have a great conversation today. We know that the Kansas City mask mandate goes into effect today. It also goes into effect in Wyandotte County tomorrow. And so we'll talk a little bit about that and how that's going to affect our areas. First, want to introduce our great doctors who are joining us today. Of course, Dr. Dana Hawkinson is here with us. I don't have a fun nickname for you like Dr. Stites does, so I will just call you by your professional name. Medical Director of Infection Control and Prevention. I know that's not as fun, but how are you? Did you have a good weekend?
I'm good. It was a good weekend. Got to spend time outdoors and just doing things and working around the house as well. It's good to be back. You know, I think the mask mandate is going to be very good and very helpful and really hopefully to change the culture here. You know, certainly I was in Colorado last week and there's a really different culture there, which I think is good and really on the public health preventive side. So today we're looking pretty good in the health system. I know that we're happy. We had seen our numbers going up to at least 24 over the past few days. The numbers have gone down. We want as few numbers as possible in the hospital, but we do have 18 in the hospital, 6 in the ICU, and 3 of those on the ventilator. So we have seen some discharges, and in that we've also seen a few admissions, but overall our current census is down from where it was, and so that's a good thing overall.
All right, we already have community questions coming in for you, so we'll get to those in just a bit. We'll get to those pretty quick, actually, today. Also have Dr. David Wild. He's the Vice President of Performance Improvement here at the health system. How are you this morning?
I'm very well, thanks.
Great. I want to get back with you and talk with some numbers, but I also wanted to introduce Dr. Ed Ellerbeck. He is the Chair of Population Health, joining us via Skype this morning. Hi, Dr. Ellerbeck. How are you?
Good morning. Great to join you this morning.
Great. Thank you so much for joining us. So we're going to talk to you just a little bit, but I did want to get back with Dr. Wild. I know you have numbers of your own. I mean, we know that we're seeing this masking mandate go in. Mm-hmm. We're seeing this, I guess, the surge that we've been talking about. I want to find out a little bit if that's the surge we've been expecting, but there are 36 states that have seen this significant increase, 10, 50% or more. So what is this telling us? What are we thinking?
Yeah. So there's a lot to unpack in a lot of numbers, and I think people use different numbers to make different cases. Maybe the first and most important point I guess I would make is I don't think that this is the surge, or definitely not the second wave. So if you look at what happened in Europe as the first wave truly came to an end, the number of new cases per day approached 0, and we've never had that in the United States. We slowed down, and now we've picked back up. But I really think that this is very likely just a sort of a continuation of that first wave. Mm-hmm. If you look sort of historically at other pandemics, including probably the most recent or the most frequently compared pandemic, the influenza pandemic in 1918, there was as well a 3 or 4 month sort of period where there were no new cases, or very, very few, this approaching 0 pattern, which we, again, have not seen. So this is likely what we've been talking about, that as we reopen, as people interact more, as physical distancing becomes harder in certain circumstances, that we would see the spread of the virus pretty similarly to maybe what we saw early on in the pandemic, and that because of that we would see more cases. Now, we have yet to see in every place, in every locality, every city, if those cases will result in the same number of hospitalizations per case, or the same rate of hospitalization that we did early on. So that is yet to be seen.
And Dana, I know you've talked about it too, because we never really saw that big dip in numbers. Yeah. It's still just been this continuation of going up.
Yeah, I really like to liken it to, if anybody's ever seen a Big Bang diagram. So you have the Big Bang event, and then you have this period afterward called inflation. I think really that's what we're seeing. It's just the initial event, and that was the first couple months, lockdown, all that stuff, and now after that we are just seeing a huge inflation in the cases overall. And even more information to that, now the CDC thinks that we probably have more like 20 million cases in the United States based on seroprevalence or antibody or serology testing, which I think if you look at the silver lining, that's pretty good, because that means that all of those people really never had to seek medical attention. So that is good, but we are still learning more about how prevalent the disease is, how far it's penetrated into our society, but it is still out there, and infections continue to increase on a daily basis. We don't want people to get numbed down because of just looking at the numbers themselves. We know that it's individuals and loved ones that are getting infected. And so really the main points, the main education is really trying to do these things with public health guidance to try and reduce the spread as much as possible.
Dr. Ellerbeck, talk to us a little bit about what you want us to know as far as a population health standpoint.
Well, yeah, I think just commenting on Dr. Wild, whether or not we're in a second wave or not, I think we're clearly not in that fall outbreak that we're all very, very concerned about. But I think we may have waves on waves. So I think over the last 3 months, we've seen a lot of the infections occurring within institutions where people couldn't socially isolate. So around half of our cases in Kansas were in nursing homes, essential workers, particularly in the food production industry, and in incarcerated individuals. And now we're seeing a much younger population. People who may have socially isolated during the last 3 months are now out there. And so I think we have an epidemic, so to speak, in a different group. So I kind of think of this as waves stacked on top of waves.
Yeah.
You agree with that?
Yeah, I think that's very true, right? We know in our own data, for example, that those that are coming to the emergency department now with symptoms that are needing to be tested here are younger. I think as of last week, 75 or 76% of those that came to the emergency room got tested in our emergency department were under the age of 50. And that's very different from early on in the pandemic. So I think that, yes, different populations. I think we see regularly that those that are in nursing homes, for example, have become very well isolated now. They weren't early on, they have now. We're not seeing near the speed of new cases in nursing homes, but we're seeing an increase in that rate of new cases in other populations and younger populations, for example.
We're going to get to media questions and questions from our viewers, but I did want to talk about masks, this mask mandate that goes into effect today. Dr. Ellerbeck, what does it mean to have this? We know it's going to go into effect in Wyandotte County tomorrow, but when you have something that goes into one area, it's not a statewide mandate yet. How does that affect and impact the rest of us? What do you expect?
Well, I think. Let me start with just the idea that I think that we've had some mixed messages, and from a public health standpoint, we may have given some confusing guidance when we were telling people about, I think in phase 1, we were talking about no more than groups of 10, phase 2, 25, phase 3, 45, or something like that. And those numbers may have clouded the issue that if you're encountering one other person whose background you're not familiar with and you don't know what their exposure's been, you need to actually institute your own personal protection mechanisms. And that's the reason why we keep emphasizing the social distancing and the masking. I think I did want to comment just a little bit because of these ordinances that some of the evidence behind masking really, and it's built on several tiers. I mean, we at the basic physics level, we know that masks actually reduce the aerosol produced by a person who might be infected and reduce the chance of transmission there. We know that on the recipient side, that a mask can reduce viral transfer within an aerosol by 6-fold or greater. We actually have data from a meta-analysis that just came out last week or the week before, June 1st, from Lancet that showed dramatic reductions in series of observational studies in transfer of viral agents in people who wore masks. And then I think more recently, last week, Health Affairs produced an article that really showed that ordinances that required mask mandates made a difference. So we've got multiple levels of evidence really saying that we need to get those masks on.
I know nobody drives down masks more than you do every single day. Are you encouraged by this? What do you expect to see from it?
Yeah, no, I think it's good. I think just as Dr. Ellerbeck was talking about, there's good population studies. Individually, we also know that even cloth face masks can filter out and protect people who are wearing them, sometimes 40 to 80% of what a surgical mask can wear. So we have some fairly good individual data, but also really good population studies saying that masks do help reduce. And we know of people, a lot of people in Asia, especially China, wear face masks on a regular basis. That is a lot for air pollution as well. So we don't really have that problem necessarily here in this area. But certainly I understand people who are wearing masks have also had a reduction in their allergy symptoms as well. So that could be another benefit.
Yeah, double. How
Yeah.
about you? What do you think, Dr.
Well, so I think it's an interesting time. I think that we do understand the benefit of wearing a mask and reducing transmission, all the things that Ed and Dana have mentioned. But the balance maybe to that good news, we have all this evidence that the balance or the bad news maybe is that even this morning, there's an article in the Wall Street Journal that shows by survey, the percentage of the American population that says they wear a mask always is less than almost any other developed country and is declining, despite the fact we have this evidence. And so I think it's a good reminder for all of us that there are really good reasons to wear a mask, that it is protect yourself, but maybe more so protect those around you, that's a respectful thing to do, that it's not really about control, but about how we take care of each other.
Yeah.
Yeah, and it's become kind of a political/social issue. It's kind of turned from a health to a social political thing. What do you think? Thoughts on that?
Well, the big issue too is people say, I'm not going to wear a mask unless I'm ill. Well, the problem with this virus, with this infection, is you can spread it without being ill or without showing symptoms. And we are seeing a higher and more proportion of people who don't ever have symptoms. But they can still spread the disease. So as far as, politicizing it, we've always tried to really just give the medical data and the medical advice, and we need to keep this as a health issue and it's not politicized, and just keep giving our message of continue to wear the mask. And hopefully, as who is ever looking at this, the individual will see more and more data, more and more stories, and then we'll obviously either by mandate or by their own volition just kind of change their actions and continue or start to wear a mask in those social areas, whether it's a quick trip or whether it's the grocery store or anything like that.
And you went to the gym for the first time, right?
Yes.
Went well?
I did, yeah. Well, luckily I went hopefully at off time, so it wasn't very busy, but I did wear a mask in there. There was another physician who was wearing a mask as well, and so that's good. Some of the other people weren't as much, but for the most part, everybody was trying to maintain physical distance as well, so that was very good.
All right. Good deal. We're going to, I want to talk a little bit about testing, Dr. Wild, here in just a moment, get to some media questions and viewer questions, but I do have some good news about the blood drive last week. So
Okay.
We knew that the numbers were down, and we got these numbers in this morning. They had projected 185 units, and they collected at the 3-day blood drive 227 units. 25% of those were first-time donors. I know I donated, and I hadn't donated since I was a junior in high school, so I was practically a first-time donor. So I was a little surprised by that, but I won't let that happen again. So they said that donors have declined by 30% over the last 10 years. So it's nice to see those numbers go up. So thank you to everybody who came down and donated blood. So we want to open it up for media questions this morning. Well, all right, jump in if you've got one, but let's get to some viewer questions. Jill, do you have a good one?
We have lots of viewer
I
questions.
bet.
Scott wrote in actually over the weekend. He has an 18-year-old daughter who self-isolated for 14 days. Now she wants to go out and be with her friends, but her friends say, not unless you have a negative test. But the doctor says, you might still show that you're positive, but are not contagious. How do you help Scott and his 18-year-old daughter? She's sad.
Yeah, this is unfortunate. I also saw another gentleman in clinic who had been diagnosed with COVID-19 in March. He had testing for 13 weeks or something like that, or had 16 or 13 tests, but it was about 80 some days, despite him having no symptoms whatsoever, feeling good, actually back to his normal self. And his family was kind of ostracizing him as well. I think it's unfortunate. If you spend that 14 days or a little bit longer, in your isolation, you should be fine to go out and interact with your loved ones and your friends. Again, continuing to maintain social distance, physical distance, 6, 8, 10 feet or more, continuing to maintain hand hygiene, and especially masks, especially if you're not able to be outside. So if you can do all those things, then it may just take a little bit of education for the friends and for the other family members. But I think that's certainly a reasonable thing to do, especially if you were isolating for 14 days.
All right, Marcia wants to know, she may be inspired by Dr. Ellerbeck's fan, but she wants to know, how does an oscillating fan affect the spread of the virus?
Yeah. I can
You want to jump on
hunt
that
it or
one?
take it.
Okay.
Why don't you start? We'll
Okay.
see if we agree.
So obviously, we know that when you are in confined areas as a room or maybe a small restaurant, there are wind currents. We know, and we're pretty certain that AC units or AC venting and stuff really does not contribute to spread of the disease. There was that one early published study, I think it was in China, where they showed several groups of families sitting next to an air vent. What did that cause any spread? It's really hard to say. I think that any spread of that, it certainly could happen, and we know that viral particles can be detected in different rooms, different areas of the hospital when people are even in isolation. Same thing could be spread here. I don't really think it poses a significant threat, but obviously, especially if the tables or the groups are separated by space, certainly you can have further dispersal of the virus. But I think as far as infectivity, if everybody's still doing everything, social, physical distancing, wearing a mask, when you're not eating, if you are indoors, really that spread and that type of thing is probably going to be more minimal than not.
Yeah, I think that's probably all right. It's possible, I suppose, that in exactly the correct circumstances, that if a fan was sitting right here and I sneezed, that it could blow it that direction instead of out. The droplets could move, and so I think it's impossible to say there's no impact. But if we think if the question is it a bad thing to have a fan? Probably not. Is it a good thing? We'll see. I don't know either.
That's a good question. Jill?
All right. I didn't know if Dr. Ellerbeck wanted to comment since he inspired the
Yeah,
question.
exactly. What are your thoughts?
No, I concur with. I thought Dana handled that very well.
All right. Allie wants to know, do you know what COVID-19 test CVS is using? Do you know if it is effective? It sounds like it might be a rapid test, perhaps.
I've had several friends who have gone to CVS, and I don't know that it's a rapid test because they're still waiting for the result at 2 to 4. So I would assume it's a PCR test, but that's the only thing.
Different locations are using different assays, and so we have seen some people come in with a 15-minute rapid result from CVS. I think in most of those cases, maybe not all, it might be an antigen test, which is a totally different style of test. Might be really good. Like if that result is positive, there's a pretty high likelihood that it's positive. There's not many false positives, but it does tend to miss a lot more. So I think it really depends. If you got a test back in a few minutes, I think in general it's safe to say most of the really rapid turnaround point of care tests have some limitations, and it's a reason we don't use any of them. So I think that answers a lot, right? We don't have in our system deployed a point of care test for COVID really anywhere, not in urgent care, it's not in the emergency department, because there are some limitations.
So what do they tell us?
Well, I think, again, if it's positive, if that result is positive, it is likely that you are true positive. If it's negative, almost all, maybe all, I don't know, there's a number of new assays every day, so I don't want to speak in terms of absolutes, but most, if not all of those rapid tests require that a negative be followed up with a PCR. So if your rapid is negative, you're still going to wait for a PCR to be collected and then resulted.
Yeah. And that's the thing. We have antigen tests for other things such as influenza and strep and things of that nature. So this type of test is not new. It's just new for COVID-19.
I had this question come up over the weekend, but if you think you've had some kind of, I call it kind of the 6 degrees of exposure. We had somebody call into our house this weekend and say that they had played golf with my spouse and that their girlfriend, that the child lives in the house, but the girlfriend of the sister had it. So it's like boom, ba boom, ba boom. And so you go, okay, so do you just isolate till you hear their test? Do you run out to CVS? Does it really matter? How do you know? I guess that's my question. How do you know when to get tested, where to go? What are your guys' thoughts?
Well, I think we have to understand, and Dr. Ellerbeck can comment on this as well, are you a contact of a known case or are you a contact of a contact, and even further on down the road? I think it starts with the contact of the known case is probably going to be highest risk.
Sure.
And then from there on, that contact of the person who knew the person that was infected, the risk goes down. So I think really you're just going to stay in, you're going to continue those public health pillars that we've been talking about, monitor for symptoms, and then certainly get the information from whoever originally had it and their contact.
Sure.
So.
Dr. Ellerbeck, I know you can't be too cautious. What are your thoughts on that?
Well, and Dana could elaborate on this, but I think it's also, they brought up the question of timing. And so if I get exposed today and I immediately go out and get tested, I'll almost certainly be negative, even if I got infected. And so you need to isolate for 5 to 7 days before you actually go out and get your testing after an exposure. Dana, correct me if I'm wrong on that.
Yeah, we think that 5 to 7 days is really the average time that most people will start to develop viral shedding. Certainly people can do it before that time after exposure, but that will probably be the optimal time.
All right, stay in and stay safe during that time.
What's the difference between an antigen and an antibody test? And if I think I was sick, should I run out and get the antibody test? Like back in March or...
So,
You can take
Yeah.
it and I'll fill in.
Yeah.
Pretty easy.
so antigen tests actually look for the presence of a specific piece of the virus. So sort of like PCR in that way. Totally different way the test is run, different sort of science behind it, but it's looking for the actual virus being present right now. Antibodies are your sort of what your body creates as a natural immune response to being infected, and so they take longer, maybe 14 days or so, to really show up in levels that can be tested and can tell us something about whether you have had the disease. So less impactful on the antibody side in diagnosing acute disease, but definitely helpful in the long run in telling us who has had it. And so if someone feels like maybe in March I had this and I really want to know, an antibody test would provide you or could provide you that answer. Of course, we still really don't have good evidence to say whether that means you can be reinfected or not, or whether you could spread to other people. So we don't really know what really to do with results of that antibody test just yet, but it can provide information if you have had it, maybe in March, for example.
And are they accurate?
There, yeah.
Yeah, most, some of the early antibody assays were maybe a little less sensitive and specific, so less accurate than those that are really commercially available and are being used now. So for example, we have sort of developed in our lab the ability to use 2 separate antibody tests based on whether we can get the reagents or the test kits. And they're both very, very, very reliable.
And I would caution against the antigen tests. Again, the antigens are on the virus. The antibodies are what our body makes. Right now, as it stands, I would really caution against using the antigen test and really try to find somewhere that uses a PCR test, which are most testing places.
Speaking of testing, you have those new numbers that you're waiting for this morning?
We actually don't have our weekend
Okay.
results back yet as far as number of positives from our lab, and also then the positive rate or the positivity rate, so the percent of the tests that were positive over the weekend. We know sort of through talking to our contacts that the number of patients showing up to be tested throughout the week across the metro last week, especially those with symptoms, increased pretty dramatically from previous weeks. Wyandotte County and Johnson County both shared some of that information. You heard probably very publicly about Kansas City, Missouri, and also that the positivity rate had been higher than the past few weeks in that higher number of tests. So we hadn't really seen that in our testing, or not maybe to the same degree. But we always see a bit of a slowdown in the number of tests we do on the weekend because we test people before surgery and some other things. And so that will maybe be something that we see in our numbers this week. We just haven't seen exactly the same response, but definitely more people coming to be tested and more positives across the community.
Dr. Ellerbeck, do you have anything to say about that as far what does that mean as far as a population health standpoint goes?
No, I don't think I have a whole lot to add there.
Got a question?
Yeah, we do have one for Dr. Ellerbeck. Deanna wants to know, how do you feel about schools opening?
Oh, boy.
Great question.
That is a really, really hard question. I think there's still a lot of controversy. We know that transmission among kids is substantially less than among adults, and their risk of illness is substantially less. But we clearly have to protect the health of our vulnerable teachers. This is going to be a very difficult balancing act. School's critically important for our kids, and we need to get them back into their educational system. But we're also going to have to make sure that we can make it safe for them and for their parents when they come back home, and for the teachers that are there with them.
Yeah, I know for my kids' school district, they're thinking of opening, but then a lot of people are thinking, yeah, they'll probably open and then pull back again. What are your guys' thoughts?
I agree with that. It's a really hard question. I think there are maybe some things that we've seen over the past week or two that point to just how challenging it will be. A number of high school sports teams having to sort of back off of their practice plans. On that sports theme, in Wichita and in Hayes, at some basketball tournaments. Club sport basketball tournaments, transmission among, at least among the parents or those in the stands. I don't think that we've seen much in the way of athlete transmission yet, but all of those questions come up, that if we see transmission in those areas, are we going to see the same thing in schools? And it's a good question. It's hard to know.
I've had parents say that the stands among the parents looks exactly the same as it did this time last year, like no difference. So maybe the kids and the athletes are doing something different, but the groupings around that.
Yeah, my father was an educator for, 50 years and did a lot of good stuff and helped a lot of people. I think school is vitally important for being in that building, given that direction, especially to those younger kids who don't get it. And if you're at home school, that's fine because you have somebody who is engaged every day doing that. Most of us parents don't do that. And so I think school is vitally important. Being in that building, being around somebody who is directing their education, but also for at-risk kids who have to be at home, who school is a safe haven, they get lunch, all that thing. There are so many details in this, so many things to consider. I think it's important. We need to keep everybody safe. We need to continue to do this methodically. But I think school being present in that building is going to be vitally important.
Cindy asks, what kind of mask do you buy online? She's asking for a brand, but is it perhaps the way that you can describe what you should buy?
Cloth masks, surgical masks. I know there's probably a lot of, most people, I get a lot of advertisements when I'm looking through my news stations or whatever on the app. People selling masks all over. I think cloth masks are cloth masks. We've talked about what they're good for. It's good for helping prevent you express viral particles when you're talking, laughing, sneezing, coughing. As far as other masks, I know there's probably a lot of, K or N95 masks that are for sale. I would be wary of those. They may provide a little bit of protection. A lot of times those have been vetted to show that they really aren't what they're cracked up to be. Otherwise, surgical masks, I think most pharmacies and even grocery stores now are getting in some type of surgical looking mask. Again, I think that's fine for the general population to wear in those instances where you can't physically distance and you're confined in small spaces like stores or anything like that.
Kathy asks, why are people getting tested if they are not showing any symptoms?
Yeah.
That's a good one.
Yeah. So we know that there are patients who go the entire course of their illness without really developing symptoms or significant enough symptoms to feel ill. There's a sort of a wide range in suggestion around what percentage of patients that might be. But I think there's plenty of evidence to show that there are patients who really never have enough symptoms to appear sick and to think maybe I had this. And so there is, I believe, value in testing those that have been exposed or have had a contact that's positive or think they may have a reason to suspect that they're positive even if they don't have symptoms. And to sort of back that up, we test every patient on admission to our hospital. We have for a month or so, maybe longer than that now. I think maybe May 13th was the start date. So longer than a month, but in that time frame, we found more than 60 patients who came to the hospital for something else who had no symptoms that were in fact positive on their test. So either they hadn't developed symptoms yet and they did later on, or they were completely asymptomatic. But we take that very seriously. So we test people without symptoms as well, and there's a reason for that. And I think there's a place for sure.
Can I just clear something up? I have a question. So just to clarify, if you think you've been exposed, you had mentioned the 5 to 7 days. So after you've had this test, is there any reason to get another test if you've taken that test, past that 5-7 day period?
That's a good question. That is a really good question. So we have people, I was contacted yesterday by somebody who got back from a traveling, adventure and wanted to get tested, and they just got back into town. In that case, I don't think it's necessarily the best thing, but we have to understand that the PCR test is really good for that day, that time, and 2 or 3 days later, probably it doesn't give us any more information. We know that, as David was talking about, when we test our perioperative patients, when they're coming in for procedures, we really don't think a test after 3 days is valid. So you can certainly go get tested again if the site that you're going to has the capacity, like a CVS, if they're able to do the test. But really that test is good for that day and maybe 1 to 2 days after that. So getting tested again, without symptoms. However, if you think you've been exposed and you know somebody who's had it, it might be a reasonable thing to do. It's going to be a case-by-case basis.
Next question.
September, she traveled to Alabama for a family emergency with a layover at DFW. Her husband is a high-risk person. Should she quarantine when she gets back in her own home? And what would that look like?
She's going in September?
Her name is September.
Oh, okay. And when is she going?
She says, I traveled.
Okay.
And so she maybe is there. And she said, when I get back.
Okay.
She said she's
take it.
doing all the safe practices while she's traveling.
So.
And Alabama's on the travel list.
Yeah, so I think it has to start like, what community do you live in? Do you live on the Missouri side or the Kansas side? Because that will really dictate a lot of that. Certainly when you get back, I would certainly try to self-quarantine or self-isolate as much as possible within the home. If the home is big enough, stay away in a separate room and a separate bathroom. Clean the high-touch surfaces in the kitchen where you're meeting. Try not to be very close, 6, 8, 10 feet or more. And again, we do have some Chinese studies that do show that there is also an improvement and a reduction in the spread of the disease if you're wearing face masks in the household as well. So doing all those things, I think, will help keep the vulnerable people, the vulnerable ones you love, as safe as possible.
I think we have time for a couple more
All right, let's do it.
questions. Jean wants to know, are plastic face shields effective without the masks underneath? Is that good enough? Is he good to go?
I would say I think the face shields are very effective. When I was traveling a few weeks ago in the airport, there was a woman who got off the plane with one of those plastic face shields that looks like a welder's mask. They offer a lot of protection, but you still have that large area that virus can get up in there. So I think there is a good physical barrier there, but I think you still need the mask. The mask is going to be important for all of that. If I had to pick versus a face shield or a mask, I would pick the mask first. If you can use them both, I think that's great. But I think that the mask itself offers more protection than just the face shield itself.
I took my kid to swim lessons last week. I was kind of that risk versus reward benefit analysis that you talk about. It was definitely necessary. So I walked in and of course the instructors had those shields on. Mm-hmm. None of the parents had any masks on. So about 20 parents, I walked in, I was the only one with a mask. So proud of myself.
Good.
So I was like, I'm going to be the leader here. My daughter was like, Mom, you're embarrassing me. Why are you wiping everything down? I was like, well, somebody has to.
Lead by example.
Right? You've got to. But yeah, good to know.
Nancy has a clarifying question about an earlier point. She said, so does the CDC think that if 20 million people are actually positive, they will also be immune to other COVID-19 infection?
So that's a pretty good question. So again, we don't understand what immunity is after you've had infection with the virus. So there are many things that go into immunity. One of those is antibodies. There is still debate over, do people with no symptoms or mild symptoms, do they make less antibody, even though they have evidence of neutralizing antibody? Also, the other thing for immunity is T cells. It's cellular immunity as well. So what is your cellular immunity? Also, even if I can't detect antibodies, if you've had the infection and I take your blood and look for antibodies and I have low levels or can't detect it, you still have memory B cells making those antibodies. So what is your response going to be? What is your body's response going to be after you see it? So we really can't answer that question about immunity. We just don't know enough. We hope that you would still have mild or no disease symptoms if you come into contact with COVID-19 again, but we really just don't know that. And especially we don't know on the high levels of people that now maybe have been shown to be asymptomatic, if we're thinking actually 20 million people have been exposed, not 2.5 million. So we just don't know the answer to that question. Again, we would hope you would have some immunity with mild or no disease if you become re-exposed to that virus, but we just don't know that. And we hope that immunity would last 3, 6, at least 9 months. And that's just something we're going to have to wait for the data on and wait for the experiments on as we move forward through this.
Jill, let's squeeze in one more quick question.
Okay, and I want to say that those we didn't get to today, we will be answering on Thursday
Yes.
because Friday is a holiday, so we won't have any update on Friday. But Janice, there's so many good questions too. I'm really having a hard time picking them today, but I feel for Janice. She's 71 years old. She swam at the YMCA 4 times every week. And she wants to know, she misses it so much. When will she be able to go back to the Y and do that safely?
Yeah.
Dr. Eller?
I think I'm going to maybe steal a line from Dana here. I think that the question really becomes, when is the risk versus the benefit right for you? I think it's impossible for us to say that on this date it will be safe. I think as what we've seen over the past few weeks here is that maybe actually there was less risk of transmission a week or two ago than there is now. And we had all hoped maybe a week or two ago that it would be better now, less risk now. So I don't want to at all think that we could say, here's a date, this is when, by this point it will be. I think you have to sort of pay attention to what's happening in the community around you. And if there are more cases, then you need to be more aggressive with the measures you're taking to prevent transmission in your own circumstances. And so for some people, that means stopping doing things like going to the Y again if you had started up. In some cases, that means wear a mask if you haven't been. In some cases, that may mean not going to do things that you had wanted to, make a trip or something of that nature. But it's really hard to say, here's when it will be safe and why.
Yeah, I think exactly. I think things were much safer right at the reopening. And we encourage people, if you're going to get your hair cut, if you're going to go, do it now. We've continued to see a lot of infection around the nation. And I think as we move more into this, also communities are going to be more microcosms and not similar. We don't want to become like Houston is right now, which is being overwhelmed like New York was. And I think as we move through this, all these different communities are going to be in these different microcosms. You have to understand, where are you going? Where is the pool? Some gyms or some clubs offer certain times for elderly patients or those at risk. Try to go during those times. Maybe try to find out when the least busy time is. Is it right in the morning? Is it after everybody goes to work, or is it later in the evening? Try to go during those times. Depending on what you're doing swimming, if you're just swimming laps and you're swimming across from somebody, you're probably not going to be at high risk of exposure. That's not going to be the major thing. But if you were in an otherwise confined space and close to each other outside of the pool, especially for 10 minutes or more, that's where going to be the risk is. So try to look at all those details and figure that out. And I think you can then determine the level of risk and determine the best time to go with the most reduced risk as possible.
Great questions today, and we'll get to those coming up in the rest of the week. But I want to get everyone's final thoughts. Jill, did you have something to add? You're good. All right, Dr. Ellerbeck, will you kick us off and give us some final thoughts? What would you like us to know?
Just to follow up on that last thing, I think what Hawk was actually inferring is that the water itself is not the major concern. I just really wanted to comment on culture and mask wearing. I grew up on a farm, so I'm a country boy at heart, and my heroes were Jesse James, Butch Cassidy, and the Lone Ranger. They all wore a mask, so I think the rest of us still can and feel comfortable with it.
That's great. Thank you for sharing that. We appreciate you being on today. Dr. Weil, final thoughts today?
Yeah, I'll second the wear a mask when you can. I think that's probably the biggest message right now, and that we're definitely not out of this. And so everything we can do, we saw that this community could bend the curve by its actions. We've seen that before. So we know that there are things that we can do as a community, and I think it's really time to pay attention to that.
Are you telling me that masking is cool now? Yeah.
Sure.
All the kids are doing it, right? Being safe is cool. Dana, your final thoughts today?
No, I think we need to reinforce the mask culture. I think, again, we have good data. We aren't making this up. We want to keep everybody safe. It's our job to keep those other vulnerable populations safe. The mask wearing is going to be for a short amount of time. If you are going into a store, running an errand, things of that nature, it's not going to be that long. You will have plenty of gas exchange, so you're going to be able to get oxygen, and carbon dioxide will be able to filter out. During that amount of time, remember, we have surgeons who do 8, 10, 12-hour surgeries with N95 or stronger mask on, so they breathe just fine. They can do that. We can do this when we're going out to our errands and doing whatever we need to do. And I think it's safe, and hopefully then we can really start to reduce the spread as much as possible, because we all want to get out and do those things that we all want to do. Get out to the Royals, get out to the Chiefs, KU, go out to restaurants and be safe in the way that we can do that.
Yeah, you said it. I second that for sure. Thank you, guys. Your insight has been really helpful today. I appreciate you being on here with me. Okay, so I'm going to give you guys a break from speaking, and I'll jump in for a quick second before we get out of here. Tomorrow, we're going to be talking about COVID-19 and then the other risk that happens this time of year. We've got 4th of July coming up next weekend. So we're going to be joined by Jennifer Parks. She is the nursing manager in plastic surgery and burns. And then Dr. Hawkinson will join us, again, talking about that risk versus reward. I'm sure you'll have some good words of wisdom as we start to decide what our plans are going to be and how big those groups are going to be, and how to play it safe. So we'll be doing that. And then on Friday, we forgot to get to these young ladies, and we want to show some pictures. We love seeing pictures of everyone staying safe out in our community. These are 2 incoming Bishop Miege High School seniors, kind of showing us how it's done. This is Molly and Daisy. They're out at the Kona Ice Truck, out at the zoo. So well done, ladies. Thank you for doing that and staying safe. Then we've got this guy. Joni wrote in. We watch the update every morning. It's very informative and very interesting. And of course, thanks to Dr. Seitz and Dr. Hawkinson. She said she's sending in this picture of this mask that she made for her husband. I saw that picture and I was like, I love that guy's mask. And go figure, he's an airline pilot. So they go out, get lots of compliments on that. So again, another person showing us how it is done. So please send in your photos, showing us how you're staying safe, wearing your mask, social distancing. How are you getting together with your friends and family and doing it the right way? So send those to our Facebook page right there at Medical News Network at kumc.edu. We also want to share your stories. We know that so many of you have been impacted in different ways, and that there are people who remind us of this disease every day, that this is the real deal. And we want you to send those stories into our Facebook Messenger or at Medical News Network at kumc.edu as well. Maybe you have a story about someone who's lost the battle with COVID and you'd like to honor them. Maybe you or someone you know has survived this disease. I know somebody who has, and it's a really great story to share. So we hope that this will help. We talk about numbers all the time, and we hope that this is an opportunity to really put a face with those numbers, a name with those numbers. These are real people that can really help us better understand here in the community that this is serious. This is a deadly disease, and it's not going anywhere anytime soon. So please share those stories. We'd love to hear from you. Thank you so much for joining us today. I'm Jessica Lovell, and we will see you tomorrow.